As one of the most common chronic medical conditions, diabetes has two types, namely, type 1 and type 2. Both have symptoms in which the levels of sugar or glucose will build up in patients' bloodstream because their body's cells cannot use insulin as well as they should. The main difference between those categories is that type 1 diabetes is mainly a genetic factor which will show up in the early age, most probably in childhood. Conversely, type 2 diabetes is usually related with some lifestyle factors such as obesity and physical inactivity. It will develop over time after adulthood. Compared with type 1, type 2 is a more common type of diabetes, and it is estimated that more than 95% of people with diabetes have type 2 diabetes. Although type 1 and type 2 have similar symptoms which are caused by insulin deficiency, the root causes are different. Pancreas is an important organ in our body which is located behind the stomach. For a healthy person, pancreas will release insulin, a special hormone which can help the body to move glucose from blood to body cells for energy. However, sometimes, the pancreas just makes very little insulin or doesn't make any insulin at all. Due to the genetic factor, in type 1 diabetes patients' bodies, their immune system will destroy insulin-making cells in pancreas, which will cause the pancreas to not be able to produce any insulin. In type 2 diabetes patients' bodies, their pancreas can still produce a small amount of pancreas, but the amount is not adequate, or their body can't recognize the insulin and use it properly, which is also called insulin resistance. Treatment-wise, type 1 diabetes patients usually need to take insulin every day because their bodies cannot produce it on its own. The normal way to take insulin is through regular injections, or a wearable insulin pump which can regularly deliver some fast-acting insulin through a thin tube. In comparison, for type 2 diabetes patients, not everyone needs to use insulin. Lots of type 2 patients do not need to take insulin because their body still has the capability to produce it. Taking medications is a common way for them to lower their blood sugar. Some of the most common medications for type 2 diabetes include metformin, sulfonylureas, meglitinides, thiazolidinediones, etc. Apart from the treatment by medication, living a healthy lifestyle is also an important factor to treat diabetes. You should try to keep your weight in the normal range, quit smoking, be active, and maintain a healthy diet every day. In summary, type 1 diabetes is from genetic factors and the symptoms will show up in childhood. Type 2 diabetes is usually developed in adulthood, especially after 45 years old, largely due to inactivity and unhealthy diet. In both cases, there is not enough insulin produced in patients' bodies to properly lower the blood sugar level. Thanks for watching. If you like the video, please hit the like button or subscribe button for more interesting topics.